In the beginning, we actually did experience ink transfer onto the instrumentation that you would see on the instruments and or the containers themselves, which would continuously come through. That was like SPD had no way of removing it, and it was there. So eventually we moved to putting those count sheets inside of a bag that was meant for sterilization and then put into the containment device. And that seemed to resolve that issue. But yeah, that's how we did it.
Rising above the buzz of ultrasonic cleaners and the clanking of stainless steel are the ideas and voices that are changing in industry. You're listening to the Beyond Clean podcast, the central nexus for the people, processes, and products that are improving our sterile processing world. Each week we speak with frontline technicians, CEOs, engineers, and entrepreneurs with a common goal to help you fight dirty. Every instrument, every time. Whether you're tuning in for education or inspiration, we're glad you did. Now turn on those washers and turn up the volume. It's time to go Beyond Clean.
This week on Beyond Clean, we speak with Kevin Anderson, Clinical Education Coordinator for Healthmark Industries. And Kevin is a registered nurse with multiple certifications, including CNOR, CRCST, CHL, CIS, and CER. Before joining Healthmark Industries, Kevin worked for 18 years in the acute care setting, serving in various clinical and leadership capacities, including clinical coordinator of general surgery, operating room manager, and manager of sterile processing and endoscopy services. His sterile processing team was recognized with Isham's Confidence Builder Award for their outstanding quality improvement in 2018. Kevin is a published author with articles featured in Outpatient Surgery and the AORN Executive Newsletter. He also enjoys producing his own written content and presenting at industry conferences, using his experiences to improve quality, education, and integrity within the field of sterile processing. He is also an active member of AORN and sits on multiple working groups for Amy and Hank. We also know Kevin as a podcaster. I can't believe that's not in his bio, but we'll talk about that a little bit during this interview. But you've come up with another very interesting and engaging conversation and really just cutting at a topic that I can't say I've seen a whole lot discussed in the industry, but it does come up, and I guess it'll just start with everybody's favorite pen.
Well, and the fact that there are no Beyond Clean pens, what's our problem? I think we should have created a merchandise first before we recorded this episode. But yeah, to add into Kevin's bio, he's a nice guy too, right? He's got all the experience, but he's just a great guy who loves the industry. And I knew that he would be a great guest to bring on to talk about this topic in particular, which is markers, pens, and how we confront them in the sterile processing space, because there are a lot of questions and there's a lot of confusion out there. And I thought, if we need to get some answers, let's get someone in and have some fun and try to drill down to some real solutions for folks out there to do the right thing with the right stuff in their department.
The right stuff. Excellent. All right. Well, let's get right into it because this guy knows what he's doing. We're going to be right back with Kevin Anderson after a short break.
You're listening to Beyond Clean, the global voice of sterile processing.
Joining us now is Kevin Anderson, Clinical Education Coordinator for Healthmark Industries. And Kevin, it doesn't seem like it's been a long time at all. Welcome back to the show. It's great to have you.
Thanks, Justin. It's great to be on the show with you guys again. Looking forward to it.
Yeah, I think we just did a vendor spotlight a few months ago, so it's nice to have you back. And we joked at the time that you had better audio quality with your microphone than I do, so you're clearly getting more experienced with podcasting. And so really always love having you on the show. And I think for this season's episode, we're going to be talking, and I love the way that Hank laid this one out, the right stuff. So we're going to be talking about pens, markers, ink, and sterile packaging. And welcome to the show once again.
Thanks, Justin. Yeah, it's an interesting topic. Looking forward to getting into it a little bit here with Hank and you guys. So it should be fun.
So Hank, I gotta ask you, How did you even come up with this topic? How did this occur to you?
Well, I get a lot of my ideas for articles and podcasts. It comes from the questions that we see on Facebook. And if you're in any of those Facebook groups, that is the voice of the industry. You know, we got frontline folks from all over the U.S., all over the globe, really. And every day they're going into Facebook, asking questions and seeking advice on the challenges that they're facing. And I kept seeing this one thing come up again and again and again. And there's a lot of heated conversations, and there's a lot of information thrown back and forth, or perhaps lack of information, if you will, on the topic of how do we deal with pins and markers when it comes to sterile packaging, and are there guidelines, are there not guidelines? Is it preference? You know, what is Joint Commission expecting? What are the options out there if you want to go one way or the other? And as we were talking before the show came on, I feel like as an industry, we're getting to the tipping point of there's so much technology out there now around label printing that all the handwriting that used to go on, 5-10 years ago is starting to transition away. And yet we still have some things that are still handwritten. And yeah, from those questions and challenges, I reached out to Kevin a couple weeks ago and said, hey, man, I got a random question for you and a random topic. Would you come on the show and talk about his topic of writing utensils in SPD?
Yeah, that's basically how it happened. Hank just reached out about it. And, like anything else, I think it's an interesting topic, and one that, just as Hank alluded to, is probably a little bit in a stage of evolution, I guess you would say, in our industry. And it's funny that you mentioned the Facebook groups. It's one thing that I'm not personally on a lot of, but I can see how on that platform people can get really, really passionate and heated about their opinions or their thoughts and things like that. So it's an interesting platform to go and find questions, and good ones at that. So this should be a fun one to get into.
I like to compare the difference between sterile processing Facebook and sterile processing LinkedIn is like LinkedIn is the arm wrestle. If you get into Facebook, it's the cage match. You don't know who's coming from what direction, and, who's about to put an elbow in you for your opinion or lack thereof. So, yeah, I think it's important to have this conversation outside of the craziness of Facebook, but still be able to speak to those topics and hopefully provide some interesting insights. So, Kevin, I kind of alluded to this, but I want to give you the opportunity to speak from experience, because you're another one of those guys that came out of the hospital setting onto the industry side, so you can kind of see both sides of this. And in your time in sterile processing and the operating room, what are some of the things that you saw that were still being handwritten just a couple of years ago? Like, can you just list out a few of those examples for us?
Sure. Well, it's pretty easy for me because as SPD manager, my first task was to institute instrument tracking. So pretty much everything when I first started was still handwritten, from your load contents and documentation, your logs, all of those things, and your actual labeling of the sets themselves was also handwritten, especially on the blue wrap packages. And then once we got switched over to instrument tracking, a lot of that documentation, the labeling, if you will, transferred over to the instrument tracking labels as opposed to the handwritten things. So what did we use handwritten things for? We still used it for a while on our biological testing logs, our quality logs, until we moved everything over into instrument tracking. So with any instrument tracking program and all those labeling abilities that we have now, sometimes it doesn't go most of the time, really, if you're doing it right, you're not going from 0 to 100 right out of the gate. You're, over time, changing things over and moving, hopefully, into a more automated, more labeling type of structure. But yeah, in the operating room, I had to try and decipher the chicken scratch that was labeled onto a blue wrap on the tape and things like that. But as I was finishing up in the hospital, most of the handwritten stuff was just maybe a check mark or a note on a count sheet or a log that was being filled out manually that hopefully would get switched over to a computerized log at some point.
Now, Kev, you mentioned the count sheet, and this is not quite the topic of this interview, but I'm just curious in your experience in the OR, did you ever work at a place where they had count sheets inside the trays themselves?
We did, actually, and we kept count sheets within the trays pretty much the entirety of my career at my former facility, and the second facility that I worked at as a contingent OR nurse. That was how they did it there as well. And in the beginning, we actually did experience ink transfer onto the instrumentation that you would see on the instruments and or the containers themselves, which would continuously come through. That was like SPD had no way of removing it, and it was there. So eventually we moved to putting those count sheets inside of a bag that was meant for sterilization and then put into the containment device. And that seemed to resolve that issue. But yeah, that's how we did it.
On the topic of ink transfer, we're going to come back to that here a little bit later, and that's why I asked about the count sheets. But before we get to there, this is true, I think, for the operating room as well as sterile processing technicians. But what's the deal with this obsession that technicians have for their pins and their markers? You know, frankly, there's a lot of folks that I worked with or who work for me in the field where if you would open up their locker, piles of markers and pins and highlighters would come out. And yet there's still that one pin that folks would stab someone over if you took their pin and you knew, don't touch Kevin's pin because that's going to be a problem there. So
it's like the red stapler in the basement of the office.
I will burn this down. So in an industry that is transitioning more digital, why the fascination or the obsession again with pins? And in your opinion, what makes a good pin for a sterile processing tech?
Well, for me personally, any pen that I really liked was just a standard ballpoint pen that wrote real thick. But that being said, as a manager, I liked not having pens available and not having markers available personally, because as an OR nurse, I remember getting trays that every once in a while you would see a pen in the tray and then you'd have to get rid of the tray. And so it was a source of contamination. So as a manager, when I went down to SPD, I was quickly trying to get rid of them. But I think that part of it is that we have people who've been in the industry a very long time and have worked through this evolution and did most of their work with pen and paper, and that's what they're comfortable with. They don't want to have to go on the computer and type up some message, or they don't want to change the process and find the whiteboard and find a marker that works for the whiteboard and the right color and write the messages out there. They want to just use their trusty old methods that worked for them for the longest time. And now we're kind of changing those processes on them. And I think it's just a matter of their comfort level with the process that they are used to. And that's common with any department. That's OR nursing, that's OR scrub techs, that's even managers. We're all guilty of trying to fall into that comfort level space where we don't want to change what we're doing, what we're used to, and how we feel is the best way to do things sometimes. So it's an uphill battle, but I think in the long run, it's going to continue to evolve that way, away from pens and markers and things like that. And I don't think that's a bad thing.
If you've ever worked for Kevin Anderson, we want to hear from you at info@beyondclean.net for when he took your pins away. So send your hate mail there, please. But Kevin, seriously, we just wrapped up the Decontamination Innovation Awards a couple of weeks ago. In that award series, we opened up ideas for innovation around the globe that would improve the decontamination process. And in that spirit, I want you to put your innovator's hat on for a second and tell me, if you were to develop the perfect sterile processing pin or marker, what would you do if you could create a pin or marker from scratch that would be used in sterile processing for the few reasons that you would find acceptable to have a pin or marker in the department? How would you design that?
Well, I guess if I was designing this pen, it would definitely have to pass certain testing, whether or not it was toxic to the users, whether it was sterilizable within all the different modalities, right? Some people are still using EO, so we have to not forget about that.
So is this the pen itself or the ink?
The ink, of course, yeah. Okay. So whatever's going on to your packaging, which in this case, we're talking about ink, that's the part that's got to be up to the test, if you will, and hopefully has been validated for those types of sterilization modalities, that they're going to be safe for the technicians and to go through those processes from start to finish.
Mm-hmm. Are you aware of any industry guidelines out there that actually speak to this? Because that makes common sense, right? You know, we don't want something toxic. It's being added into the process. Like, we just got these devices clean and we're packaging them to go through the sterilization process. The last thing we want to do is add something that's going to take us back, you know, not even back to zero dirty, but actually maybe even more toxic than it was when it came in decontam. So are there guidelines out there that are talking about this, or is this just kind of common sense with a little bit of science?
Yeah, I mean, I think it's both. I can definitely refer you to the ANSI/AAMI ST79 guideline in terms of labeling products. It does mention that any marker should be free of toxic components and dyes. So it does specifically say that. One thing that I find interesting about that, though, is if you were to look at a common Sharpie marker, which is actually pretty common to see in an SPD as well, some of them will have a mark indicating on them that they have been certified non-toxic. Some of them do not. Some of them do have that. However, there are markers that are available that have actually been tested for use in our sterile processing environment. So that's an interesting next level up, if you will, and something that I actually discovered when I was an SPD manager, because I actually ran into this question myself and had to kind of look into it and find out what I could be using before we had our instrument tracking.
And so, to your knowledge, in the industry today, are there products that are not only non-toxic, but have also gone through those validation processes according to hydrogen peroxide, to steam sterilization, to ETO? Is there such a thing on the market, or do we just have to compromise with the best Sharpie that we can find?
Well, hopefully for people who have looked into this, they have found the same answer I have, at least. I've only found one marker that I know of, and it does actually come from Healthmark, incidentally, but I did discover this before I worked with Healthmark, so I'm not trying to be too commercial or anything like that, but Healthmark does offer a range of color markers that have been approved for all of our sterilization modalities and is also non-toxic and has that testing behind it. So if you are one of those facilities that really likes to have those markers, whether it's fine tipped or thick tipped, and you want it for labeling the outside of a blue wrap package, or if you need it for marking a count sheet or something like that, we do have it. So it is available through Healthmark.
And so, to keep this vendor neutral, if the audience is aware of any other manufacturers that have a non-toxic validated pen or marker, we'd love to hear about that too. Make sure and put that in the comments section on any of the threads you see on this episode, because we're about having an education conversation out here to spread the news that this is an important topic and that there is innovation that needs to happen if we want to keep ourselves safe and keep the patient safe, like Kevin was talking about earlier. Now, Justin, I think I stole your thunder a little bit earlier, but I want to give you an opportunity here to weigh on it.
This is my topic. This is the part. See, this is what's always stuck out to me about those markers. In the instrument world, people identifying or using markers for identification purposes on the instruments. That's what's always kind of made me crazy. And we know that ink transfer is an issue, but maybe they are saying it's not an issue when it's purposeful. I'm not really sure, but but how many times in lieu of, tape and dipping, which both have their own challenges in terms of maintenance, but at least they're validated for use, right? Then we see people trying to mark instruments or almost sometimes even assign them to the surgeon, right? Just by writing on the instrument. Yeah. So I don't know. I'd like to hear a crazy story if you've got one, Kevin, but have you ever seen instruments be marked in that way for identification purposes, maybe to the department or?
Yeah, no, you're absolutely right, Justin. As a former OR nurse, I did see it. We had very specific instruments that were for specific surgeons, and it wasn't unusual to see instruments marked literally with some sort of Sharpie type marker. I don't know if it was a Sharpie, but it was definitely permanent, and it was right on the instrument. And then there were other ways as well that people used, and it was some sort of etching device or engraving device, I should say. And those instruments were probably from 20 to 40, anywhere between 20 and 40 years ago, because it would say our hospital's former name on it, which was like, at least 25 years prior. So these instruments had been around a long time, and somebody had a need and they wanted to identify these instruments according to either their department. These ones belong to the OB department, or this one belonged to Dr. So-and-so. And that was their method. They either engraved them with their own little tools in the department, or they marked them with a Sharpie.
Yeah, my favorite thing about the engraving is when it's got a nice little rust stain coming out of the trough that's been carved into the instrument. But tying it back to ink and ink transfer, like, obviously you said you had seen that. Do you think that not only SPD, but the OR, how serious do you think people take ink transfer, especially as it relates to having count sheets in the trays? In your experience, do people raise the red flag up the pole when they see that, or is that something that just kind of gets tolerated?
That's a great question, Justin. And I think this would probably vary widely across different facilities and things like that. But in my experience, we always had one or two people in the OR that would raise the flag over everything, depending on what the situation was. In this particular case, it seemed like we had an answer, and this was before I was the manager, but putting those things inside the bags, putting the count sheets inside the bags, solved the problem. We couldn't get rid of the ink that did transfer, so I think they just replaced those items. But largely, I could see there's definitely times where people, I think, become numb to these things, and they see it, they might question it, and they might get some sort of answer, but not enough to really cause them to really question whether or not the tray is sterile or anything like that. So I think it's just really dependent on what facility you're at and what people's understanding is of what this issue really entails.
So, Kev, to keep us consistent here, we've been talking about the toxicity of inks and markers. But, Justin just brought up a good point. There's ink on these paper count sheets. Are you aware of any validated printer cartridges out there for Steam, for vPro, for ETO? If not, do you see that as a potential challenge around being consistent with how we treat ink in sterile processing?
Yeah, that's a great question. I'm not aware of any validated toners or inks per se. However, I did dig up an old AORN article about it where they had actually tested this very thing. I believe Nancy Chobin is one of the authors of the article, but they actually tested pre-printed labels. They also tested count sheet inks for cytotoxic response after the process, and it looks like they were able to basically show that they did not have a cytotoxic response. And so there has been some research in this area, which is interesting. And this article actually is pretty old now. It's actually from 2009 or 2008 rather. So this is not a new question, believe it or not. It's been around and people have actually worked on it. I don't know if you have actually found anything newer in your studies or through digging into this a little bit, but that's one that stuck out to me when I was looking it up.
Yeah, what we'll do, Kevin, is we'll get a link to that article, or if it's in PDF form, we can attach it to this episode through the Beyond Clean app so folks can go read it. I haven't seen anything else out there like that. I do remember that article now that you say that. And yeah, it's interesting. In 2008, they're asking the question, and here we are in 2021, and we still have folks in the industry asking the same questions and having the same concerns. And that's what I love about how our industry is transitioning, though, into digital media, whereas before you had to catch that particular magazine issue or go to that particular conference or you're never going to hear about this topic. Now you just happen to log on to Facebook or listen to a podcast, and hundreds and thousands of people get to hear that conversation at once. And it's just such an exciting time, to be talking about these issues as random as they are and as old as they are, because I feel like now we can move much more quickly to consensus and to solutions than we were able to before.
Yeah, I agree. And it is interesting that you mention how all these resources are now way more readily available. And I couldn't agree more. It's one of those things where when I was first starting my career, you're right. You had to have the right journal or subscription or whatever, or talk to the right people that knew of these things and stay on top of it. But like you said, now there's a lot more resources available to us. It's almost like you have to try to stay out of it in order to miss it. So it's a good time to be adding to the discussion and bringing those resources out and trying to share them to people.
So, Kev, I'm going to give you the opportunity to have the last word on this topic, or maybe the last encouragement, right? So we view this podcast and this movement really toward digital education and conversation as an opportunity to inspire folks to think big, to encourage innovation out there, as we mentioned before, to encourage collaboration and to study and research in all these different ways. But on this topic of ink, marker, patient safety, toxicity, all those things, would you want to add anything else to the conversation that we haven't already covered?
Yeah, I guess for some final thoughts about it, I know that there's going to be a lot of people out there who are still dealing with not having instrument tracking, so they're writing out labels for instrument sets, or they're writing on their count sheets physically, all of those things. I just want to encourage people that I know that these newer technologies can be scary and a little bit intimidating and cause a lot of frustration, because the learning curve can be really steep for some people who are not familiar with the technology. But from an end user standpoint, somebody who's in the operating room who has to read these labels and try to decipher what these instrument sets are, and do I have everything that I need, and is it going to be safe, right? All of these questions are going to be answered more readily when you have a label that you can read, that you have a label where you don't have to question whether or not it's done with something toxic, something that's approved for the process. That's what we want. And we want some uniformity when it does come to this labeling and or the count sheets and how they're filled out. This is a safety thing. If we don't have the trays that we thought we had because we couldn't read them or what have you, which this is stuff that's really happened. When we did not have instrument tracking, there were a lot of times where you'd have 4 of the same type of total knee setup, but they were all labeled differently. And so you had to try and figure it out by the shape of the box, and you had to, kind of feel them out and figure it out yourself based on your experience. So just understand that all of this that we do as we try and advance as it pertains to these labeling and markers and all of that, and other things as well. Just keep an open mind and allow it to move forward and move with it, and just embrace it. Understand that you're not going to be comfortable sometimes, but that's okay, and hopefully these things are going to make things safer for the end user and more importantly, the patient.
Yeah, Kevin, consistency is king. And you just brought out something that is so critical there is the standardization of the information. And that's not really what we're talking about, but it's a parallel conversation, very similar to one that we had last season around signage. And it all comes down to proper communication, proper standardization of how you communicate. And I got to tell you, you are an excellent communicator. We love having you on the show. And I just want to thank you so much for coming on. This one went really fast.
Well, thank you, Justin and Hank and Aaron. You guys are great. It's always a pleasure talking with you guys. I love the various topics and just that here we all are, it's been 3 years for you guys and almost a year now for our podcast and all these different webinars and just the amount of education that is coming out and being more available. That's one thing that's been good about 2020 is it's made education even more available, I think, than other years. So it's always a pleasure, and I appreciate the invite. Hopefully we'll do it again sometime.
Oh, you can count on it. That was Kevin Anderson, Clinical Education Coordinator for Healthmark Industries. And Hank, this was such an interesting topic. I'm surprised it flew by as much as it did. And there was a lot more depth to this conversation than I really thought there was. I thought, oh, here's Hank coming up with one of his crazy topic ideas. And we almost went over the time limit and we left a few things on the table. There were so many side conversations that could have been had as part of that. And we did a good job of kind of keeping it narrow. But our interview with Gary last season is the first thing I thought about is just the labeling and how to make sure that we're standardized. But the whole idea of the toxicity and some of the studies that Kevin mentioned, I didn't realize that had been done. I'm actually kind of glad that at least some research on the topic has been conducted.
Yeah, Justin, there's probably 10, 20 topics in the industry that are just beat to death. Everyone, like if you think education and sterile processing, those are the 10 to 20 topics that you think of. But here we are, 12 seasons into the Beyond Clean podcast, hundreds of episodes done, and we are still scratching the surface of important and engaging educational topics, and this is one of them. What do we do with the markers and pins in our departments, and how do we ensure that they're not only safe, but they've been validated for the processes that we're using them for? And yeah, I love these topics. These are the topics that give me juice, the crazy ones, but the ones that if you're in the field actually doing the work, these are the questions that you're confronted with. And we're going to continue asking these questions and hopefully having great guests on like Kevin to give us some good answers.
Yeah, that gray area, that's what makes this show fun after what's coming up on nearly 4 years. And congratulations to Kevin, too, because right around the time, and he alluded to this as we were wrapping up the interview, but right about the time that this episode releases, Kevin will have a full year of weekly podcasts under his belt. And I can tell you, that's no easy task. Committing to a podcast every single week for a year. It sounds like a New Year's resolution, Hank, and it's one that I'm glad Kevin's made. He's done a very nice job with Healthmark and the podcast over there. But that's going to do it for this week's show. As a reminder, you can help support Beyond Clean by subscribing on iTunes, Stitcher, Google Podcasts, and Spotify, or you can download our smartphone application for iPhone and Android. We'd certainly appreciate a rating and a review because your feedback is important to the success of this show. And if you have any topics that you'd like us to cover on a future episode, just send an email to info@beyondclean.net. On behalf of Hank and myself, thank you for listening to this week's episode of Beyond Clean.